Have you ever known a loved one who is suffering from a severe illness? What if there was a way to help them with their severe pain but it was illegal? Every year, an estimated 1.7 million people are diagnosed with cancer. Cheyenne Shaw is a prime example of someone who was diagnosed with cancer and helped by cannabis. At the young age of 23, she found out she had stage 4 ovarian cancer. During her chemo treatments, the cannabis helped her regain her appetite, reduce her nausea, her pain, and her risk of sickness dramatically. One of the 1.7 million people who will become diagnosed with cancer could be someone you know. Over the next few minutes, I'll be discussing the roles that medical marijuana could play, comparisons to legal substances, how you or a loved one could benefit from it, and much more. Medical marijuana could fill many important roles in the medical field, but access and research is limited due to federal laws, preventing the practice and use of medical marijuana. Research has shown that marijuana has the ability to alleviate neuropathic pain, a notoriously difficult to treat type of nerve pain associated with cancer, diabetes, HIV, AIDS, spinal cord injury, and many others. Each of these trials discovered that marijuana reduced patients' pain levels to a degree that was as good, if not better, than currently available medications. Compared to a lot of other available medications, cannabis has a remarkable safety record. Unlike others such as oxycodone, regardless of the quantity or potency, cannabis cannot induce a fatal dose. Throughout the past decade, alcohol has proven to be much more dangerous and far more likely to induce violence and aggression than marijuana, yet alcohol still is legal and marijuana remains illegal. Studies determined that alcohol was a significant contributor to death and responsible for 3.2% of the total burden of disease and injury, whereas marijuana was responsible for 0 deaths and just 0.2% of the total burden of disease and injury. Injuries and disease of alcohol is 16 times the amount of cannabis. When it comes to a substance that will put someone at risk for getting hurt or hurting others, alcohol is considered to cause the most harm. Not only have people learned that marijuana can help us as individuals, but many have begun to learn that it also helps the economy. Last year alone, the marijuana industry brought in a whopping $2.75 billion in revenue. Some say marijuana significantly impairs physical and mental functions. When it comes to impairment, one study found that marijuana increased the odds of being in a car accident by 83%, which may sound like a lot. When being compared to a legal substance such as alcohol, the odds of being in a car accident increased by more than 2,200%. There's always a risk of impairment, but if used responsibly, marijuana can be very safe. A lot of people say that cannabis is linked with mental health problems such as depression, anxiety, suicidal thoughts among adolescents, and personality disturbances, including a lack of motivation to engage in typically rewarding activities. This is not entirely true. Some people do in fact use marijuana to numb these feelings, but cannabis does not directly cause it. People who regularly use marijuana are actually more likely to be more outgoing, socially active, and more inclined to practice sports. The idea of using cannabis for medical purposes is a no-brainer. It would help a lot of different people in a lot of different ways. As for using it recreationally, as long as it is properly distributed and used responsibly, there would be no harm. I hope I have helped you see the truth behind marijuana and its benefits, and help you see the past of lies.